Okay, good. And how is everything in Laos?
So here we're set up around 3 rooms. So we have the translator in this room, I'm in this room, and our colleagues at the Nutrition Center are sitting outside. Normally, the seminar is opened by the Nutrition Center, by the director or the deputy director, but both of them are in a high-level meeting today. So they have asked if I would be the opener, but we're just double-checking that they have not been able to come out because they would like someone, a representative of the Nutrition Center would prefer to open. So we're just confirming. If they're not, then I will just say a few words and introduce who you are, and that's it. So for my benefit, for being able to introduce you, when was this survey done?
So the Adherence and Feasibility Study was conducted in July 2022.
Okay, so that's what I thought, last year, no?
Last year, but then, the landscape analysis was conducted before that, but I will discuss on that.
Great.
Yeah. So you hear me clearly or not? Because this room is a bit
okay. หมายถึงจะให้ค่อยเก้าหรือว่าจะสิเก้าโอเคเจ้าสิเก้าแล้วจะอ้นใครแล้วค่อยสิอ้นพลังโอเคแต่เจ้าเป็นผู้เว้าอันทุกคนที่ว่าเรื่องแปลภาษาเนาะเรื่องการบัดคิดว่าสำหรับทางพลายอยากฟังภาษาลาวสวัสดีใครเรียนนี่เด้อสินะว่าเจ้าก็เว้าก็ได้นะโดยมีแต่ที่ดาวต้องพูดหลายนึงจากว่าแม่น่ะไปสิได้บ่ได้จะเว้านั้นแล้วก็เว้าเรื่องการคิดแล้วค่อยสิเว้าคือกันในภาษาอังกฤษแล้วเพื่อคนมี2เทื่อที่เข้าใจเพราะว่าผ่านมาเคยมีแบบส่วนหลายมีแต่ทหารเดียวที่ว่าคนบ่เข้าใจว่าต้องคิดno perfect
I'm trying to find a location where we have the strong Wi-Fi, it's so I might just off camera, when I speak because sometimes it's video, it's not good for the internet.
Totally. You feel free to turn your camera off. We understand completely. And especially people are going to be focused on your slides. So please don't feel need to have your camera on. We might ask you to put your camera on just for a moment at the very beginning when you say hello, and then turn it off. And then if you want at the end, you can turn back on again, but it's not necessary to keep it on the whole time. It's better to preserve the internet.
Thank you.
I'm going to go dark at 2 o'clock until 2 o'clock. At 2 o'clock, my colleague, Dr. Kantali, Madam Kantali, will just say something very quickly to explain why our bosses couldn't be the ones to open the meeting. And then I will say just a few words, 2 sentences, 3 sentences, and then you're on. Okay?
Great.
So you can share your presentation and have it up on the screen now if you want, and you can turn your camera off. It's your choice. Okay?
Let me see about the sharing the screen. You see, in Cambodia, we use the team a lot,
not Zoom. Here it's a mix.
Sometimes it's okay. I think now we can.
Great, and give it a click to be the presentation mode.
Is that okay?
Perfect. That looks great. Hello.
Okay, great.
And so the interpreter will be on. There is an interpretation button so that people can ask questions in either language and we can answer, and you can answer in English. just sometimes it gets a bit confusing when it's question time. So I'm sure you can figure it out, but just so you know, we will have the interpretation function working and our translator is ready to go listening to you.
Okay, that's fine. Hello, Celine.
Mấy cái cục buồn sang như thế.
Người ta phảiเป็นระบบปกติและมีการรักษาลักษณะจากแต่ที่กองประชุมกำลังผลของการไว้เกี่ยวกับในว่าคุณค่าเป็น
สบายดีโดยเนื่องจากว่าฮอดเวลาแล้วเนาะมีแต่ว่าขออนุญาตต่างหน้าจากศูนย์โภชนาการเนาะเนื่องจากว่าทางคณะศูนย์ทั้งสองท่านเพิ่นติดภารกิจด่วนเนาะฉะนั้นพวกเราจะได้เริ่มพิธีก่อนอื่นเบิดก็ขอเรียนทางท่านเคลลี่คำพูไซเนาะโครงการ ANRCB กล่าวให้มีคำเห็นในการสัมมนาในครั้งนี้ก่อนเนาะแต่ก่อนอื่นเบิดเราจะมีปุ่มแปลเป็นภาษาลาวและอังกฤษอยู่ที่หน้าจอเนาะท่านสามารถเลือกฟังภาษาใดเจ้าขอมอบเวทีนี้ให้ทางเคลลี่เลย
Just about as Katali said, my name is Kelly Kampusai, and I am the project manager of the Applied Nutrition Research Capacity Building Project, or ANRCB, here in Laos. We partner with the Lao Nutrition Center, and today the Nutrition Center is proud to host our colleague from Cambodia, Mr. Hou Kroeun, he's the country director of Helen, Keller International. And today he will share with us about the process of research and the outcomes of the research that was done in the last few years in Cambodia around multiple micronutrient supplements for pregnant women. We are very excited to hear this topic today as it's an issue quite relevant to Laos, and we feel that this can be a big opportunity for us to think about the implications of these issues in Laos and what is necessary as we move forward to improve maternal nutrition here as well. The seminar is translated into into Lao, and if you hear me in English, you want to hear Lao, please click on the button that says interpretation with a picture of the world at the bottom. ถ้ามันฟังภาษาอังกฤษอยู่อยากฟังภาษาลาวช่วยกดอยู่ลงที่เขียนว่า interpretation เด้อมีหัวรูปนั่นกดไว้โลด At the end of his presentation today, we will have some time for questions. So please make a note of questions you have and take the opportunity to discuss this important topic together. And as always, the nutrition research seminars hosted by the Nutrition Center and ANRCB are always uploaded to the ANRCB YouTube channel about a week or so after the webinar. So if you don't catch it all or you want to share with your colleagues, please feel free to look up there. If you Google ANRCB YouTube, you will find it. Thank you very much. And now I want to invite Mr. Kroeun to begin. Make sure you put your presentation mode.
Thank you very much, Kathleen, and good afternoon, everyone. Thank you very much for this opportunity. And in the next 10 minutes, I have 60 minutes, right? Or 40 minutes. In the next 40 minutes, I am pleased to share Cambodia experience in a study on multiple micronutrient supplementation for pregnant women. And this study is aiming at, replacing the IFA, the iron acid folate, with MMS micronutrient supplementations. And as Kelly already introduced, I am Hou Kroeun, country director, Helen, Keller International, Cambodia. And it is my great pleasure to present this study on behalf of the Cambodian team. And allow me to, stop the video for the sake of the Wi-Fi here. Thank you very much. So, the public health program have long promoted dietary change and the use of the dietary supplements, particularly iron acid folate, IFA, to prevent the micronutrient deficiency during the pregnancy. However, those interventions alone seem to be insufficient to fill the various micronutrient gaps, and it may exist in many countries, including Cambodia and Laos, PRD. So this prompted the UNICEF along with World Health Organizations and the United Nations University to develop the United Nations International Multiple Micronutrient Alternative Care Preparations. It called UNEMAP in 1999, I think, to provide recommended daily allowance for 15 micronutrients, including IFA, and offer a cost-effective strategy to address a broad spectrum of micronutrient deficiency. So far, I can say that MMS is proven to be one of the most impactful nutrition interventions that can significantly improve maternal health, birth outcome, and intergeneral economic gain and benefit. You see the slide? Let me just
You can see it well.
Okay, so the global evidence from high quality randomized trial demonstrate that daily supplementation with the MMS, so that is, multiple micronutrient supplementation, so I call MMS, in pregnant women compared with the supplementation with IFA alone improve the birth outcome. So that is very clear. So two systematic review and meta-analysis show that MMS reduce the risk of baby being born with a low birth weight by 12 and 14%, because it's two different studies, right? But it's a significant reductions in low birth weight, and then reduce the risk of small for gestation's egg birth by 3 to 8%, you can see on the slide, and also reduce preterm birth by 5 to 7%. As you can see, there have been 21 randomized controlled trials around the world that compare MMS with IFA, and the trial captured the data from 141,000 pregnant women. So that is really a big evidence for the impact of the MMS, compared with the IFA. And the MMS was found to provide a robust and consistent 12% in reduction of risk of having baby with a low birth weight. That is another study, which I can also share the link after this workshop. Please let me know, Kelly, if I am going too fast for the translation.
So far, so good.
Okay, so you can see this table. I just want to bring your attention. Let us consider what that could mean for Cambodia and Laos. Can you please mute? Can you please mute so that Okay, thank you very much. So let us see this table and let us consider what that could mean for Cambodia and Laos PRD. You can see 2021 modeling analysis look at the impact of scaling ANC nutrition interventions on human capital and labor market outcome across 132 low and middle income countries, including Cambodia and Laos PRD. The table show the result of IFA and MMS, but the analysis look at the calcium supplementations and balanced energy proteins during pregnancy as well. if you are interested to see how this figure were calculated, the source is given below. You can see, you can download that source and see more detail. But the outcome so calculated for the cohort of children from children born from 2020, of course, these are the estimate based on modeling analysis, but the results are really interesting to us, I mean, especially to me. Comparing the benefit of IFA supplementation at 90% coverage with MMS at 90 coverage, you can see a huge difference here. For example, education level are estimated to increase significantly both in absolute school year gain for children born between 2015-2020, as well as the comparisons of secondary school, right? You can see that children in the birth cohort would gain 8,590 school hours and 294 more youth would complete the secondary school if the pregnant woman have taken the MMS, right? This may not seem huge, but if you look at how that information translated to economic gain, you can see that the increased combined lifetime wage across the cohort would be an additional more than $9 million if multiple micronutrient supplementation reach at 90% coverage when their mother were pregnant compared to iron folic acid reach 90% of coverage. So, even reaching 50% coverage of MMS produce more than 3 times lifetime wage compared to the 90% coverage of IFA. So that is really, really interesting to me. I thought that slide would have the audience in the loud POD think about the future. So after a decade of research, the World Health Organization released a context-specific recommendation for the MMS, including in the population affected by an emergency and in other contexts support by the rigorous research as part of the ANC for pregnant women. And finally, MMS was included in the World Health Organization Essential Medicine list, which is a significant step toward for procurement, supply, and implementation effort, and ultimately for widely acceptability and use of the MMS. So, because of significant benefit of MMS, Helen Keller, Cambodia, with funding support from the Vitamin Angel, initiated the landscape analysis in 2021 among the government stakeholder, UN agency and civil society organizations, as well as the private sector on the interest of the MMS. And the results from this landscape analysis were discussed during the consensus building workshop in 2021, which was conducted with the stakeholder who participated in the landscape analysis exercise in order to agree on the next step in transitions the IFA to MMS. So overall, the consensus building workshop conclude with the 5 points. They, in principle, fully agree for Cambodia to consider in transitions from IFA to MMS. And to do that, the stakeholder recommended to create a steering committee comprising of key stakeholder and influencer with the clear term of reference so that everyone is clear about what they will contribute in the steering committee. And the third one is that they recommend to develop a technical policy brief, including the global evidence for the use in, for the advocacy to the decision maker and planner, so that they all are in the same page and they are support for Cambodia to replace the IFA with the MMS, right? And then they also recommend, to conduct a pilot test for the feasibility adherence study in line with the World Health Organization recommendation to identify the potential barrier and appropriate strategy for the rollout if we are successful in the pilot of this MMS initiative. And finally, they recommend, to generate evidence and guidance around the key recommendation, including the cost and implementation and delivery mechanism, because they actually have the concern. I mean, the stakeholder, especially Ministry of Health, have the concern during the consensus building workshop about the cost of the MMS over IFA, when we roll out. So that was discussed a lot. Sorry. So right after the consensus building workshop, the MMS steering committee, chaired by Excellency Pratsaponari, the Secretary of State for Health, was established to bring together the key stakeholders who can provide advisory support and technical input to the Ministry of Health related to introductions of MMS for pregnant women in Cambodia. And the steering committee consists of technical experts from the government institutions, civil society organization, UN agency, and the donor representative. So what are the research questions? Based on the discussion with the steering committee, the research questions were developed, and there are 4 research questions for the MMS Adherence and Feasibility Study, and that include, first research question was that what factor influence adherence to MMS intake among the pregnant women, and is the MMS non-inferior to the IFA, meaning that, the IFA coverage, for example, it is account for 90% in Cambodia. Will the MMS have the same coverage to the IFA or not? So that is important questions, right? If we want to replace IFA with the MMS. And then, another question is that does the quality of the pill a woman receive at the ANC visit influence her attendance at the, a later ANC visit? So that is another question. And finally, what factors should be considered in a rollout and marketing strategy for the MMS scale up in the countries? So here's the study aim for this research. The aim of the MMS study is to assess the factor that influence optimal MMS consumption during pregnancy and provide recommendation to the steering committee to effectively transition to the distribution of MMS supplement as part of the routine ANC service in Cambodia. And the specific objective of the study include to assess the acceptability of IFA and MMS supplement among pregnant women in the study site, and assess the non-interferiority of the MMS compared to IFA supplementations, to assess the impact of pill count quantity provided at one time on the AC attendant by the pregnant woman, and evaluate factor that influence adherent behavior. And finally, develop recommendation for product marketing and service delivery to encourage adherence to MMS supplementations. So the research utilized a mixed method approach to collect the quantitative and qualitative data and triangulate the finding from diverse participants. So along longitudinal quantitative survey and pill bottle weighting and pill count among prospective cohort of pregnant women assigned to one of the three arms to assess the acceptability, adherence, non-inferiority of the adherent and ANC attendance. And we also, conduct the focus group discussions among the pregnant women, influential family member and midwives, and in-depth interview among pregnant women, MCA chief and the supplementation manufacturer, retailer, observation survey, also, those who actually run the pharmacy and the formal drugstore, in order to identify and evaluate factors that influence the adherence and develop recommendation for the MMS intervention and scale up strategy, right? Sorry. So, a total of I think over 5,000 pregnant women from a province of Cambodia called Kampong Thom are recruited at the first ANC visit from 48 health center, and the women are randomized to one of the three arms at the health center level, either to IFA 90 group, which receive 60 IFA tablet at the ANC 1 and 30 tablet at the ANC 2. MMS 90 group receive 90 MMS tablet at ANC visit 1 and then 90 tablet at ANC visit 2. Or MMS 180 group receiving 180 tablet at ANC visit 1. So that is the study group. So here the time point for the study, if you can see the time point for data collection for the study at 30 days, 90 days for all study arm, and 180 days only for the MMS group. The adherence survey include the completing the informations and the data on pill weight and pill count, asking women about the pill miss or the pill they share with other women, and any side effect or benefit from taking the pill. The acceptability survey include asking women about the experience and the preferences regarding the MMS, IFA, and ANC counselings they exposed to. If you look at this table, I just want to show the number of pregnant women participate at each time point of the study. As I mentioned earlier, a total of over 1,500 pregnant women were completely enrolled at the time of the study startup. But when we conducted the data collection at a 30-day time point, 1,401 pregnant women were available to join the data collections. At the 90-day time point, 1,341 pregnant women participated in the survey, and finally, at 180 days, 574 pregnant women joined the survey from both MMS group. Until now, we see that 12% of the pregnant women or the study participants have been dropped out from the study. But, it's still very good rate, because in the previous study, we found that even, 30% of the pregnant women or women of reproductive age, dropped from the study for the supplementation type of study like this. So, sorry. So you can see that one of the important role of the steering committee is to provide the feedback to the study team. And so far, there has been 2 field visits conducted by the steering committee, led by the chair, which is Excellency Dr. Pratsaponari, to give the feedback to the study team. So, in each at the end of each study visit, they meet together with us and discuss about what finding they found during the visit, and then they provide the recommendations to us. And here are the key recommendations from the steering committee. They suggested that the study team should find the best name of for the MMS. The term, they said that the term of MMS in Khmer is too long and not understood by the rural Cambodian people. So they suggested to use the term of multivitamin instead of the MMS, because that would provide, the full meaning to the rural people, because they know vitamin, right? And they know that vitamin is good for the health. The steering committee also suggested that we conduct a formative research study on the MMS product packaging to test the packaging design, color, text, and photo of the design, so that, at the end of the day, we will have a design which is contextualized to Cambodia specific, and those pictures, those text will be liked by the pregnant woman, right? They also recommended to consider 2 bottles of 90 tablets of the MMS instead of 1 bottle of 180 tablets. This will help keep the quality of the MMS peel from oxidations, because we had the experience that some MMS bottle is not many, only a few, have problem with the colorations, right? Change the color. So the other thing is that they said, providing a clear message on MMS benefit is another important factor to be considered. This could help MMS adherence to be increased. and make, pregnant women like taking the MMS as well. And finally, the steering committee advised the health center and project staff to integrate the message on the exclusive breastfeeding during the field visit and nutrition counseling, so that the counseling is not only about the MMS but also give the benefit on the breastfeeding and other nutrition messaging as well. And here, this slide indicate the feedback from the pregnant women who participated in the study. You can see based on the study team observations, of course, the result and the finding from the study will be presented 2024, but this is based on the observation from our study team. They said the pregnant woman from MMS study group provide positive feedback after taking the MMS in comparison to the IFA group. They said MMS tastes and smell better than IFA, and that MMS make them, the pregnant woman, feel good, and they have more energy and can eat and sleep very well after taking the MMS. They feel that they gained more weight, after taking MMS a few months. And they said that they would want all health centers in Cambodia to have MMS to provide to all pregnant women, the same like them who come to receive the ANC service at the health center. And you can see the women from the IFA group said the opposite, right? They said IFA is hard to take. It smells very bad and make them feel vomiting and nauseous, and this is not only a few, but most of them, say that. So very, very interesting. And here's a quote from the study participant. I can just translate it to you roughly. She said, "This is my second pregnancy. When I started taking MMS regularly, as per advice from the health center, I started sleeping very well, eating more food than before, having good feeling energetic, and I can work normally. I am very happy to take MMS for my health and my baby health." So that is what she said. This is a brief on the study timeline. You can see this table indicate different data collections in the study and the timeline. The Adherence and Feasibility Survey is planned to be completed this month, December 2023. And there are 3 types of focus group discussions with the influential family member, pregnant woman, and midwife have already been completed. And the in-depth interview with other participants and manufacturers were completed in the summer. But finally, the market observational survey is planned to complete in December 2023, this month. So, so we found a number of challenges we actually face from this study, right? If you can see here. So the MMS is being introduced to Cambodia just in 2023. I mean, although the study enrolled somehow last year, but the woman only exposed to the MMS this year. So we consider, this is a kind of new product. I mean, it's not a new product for other country, but for Cambodia is a new product. So, sometimes the women are reluctant to take it, right? So it needs to be very, very intensive counseling and education to the woman to raise awareness on the benefit and importance of the MMS, right? What we also found during the study is that some women, only a few women remove the dissecant from the bottle, and that causing the pill, the tablet degradations, because it live without the protections, right? Because scientifically they put that dissecant in the bottle, the black, right? The black thing that you always see in the bottle to protect the tablet. If they remove that, will affect to the tablet. So we need to replace that bottle with a new bottle. So, that is one of the challenge. Some women tamper with the bottle lid for the ease of opening of the bottle. So that is one of the challenge. And some women lost the MMS bottle or spilled the bottle on the ground. So, the tablets, just discard on the ground, and we have to replace it with a new bottle to them for this type of the incident. A woman also has the daily work, which also affect to the study as well, because some of them did not come to the second time to pick up the bottle from the health center. And this is, again, we found 12% for the dropout, but it's not only this reason. They have a multiple reason for the 12%. So what are the solutions? At the ANC1, midwife explained the advantage of the MMS to pregnant women and potential side effect, to them. So they understand, this MMS effect is very low to none compared with the IFA, so that they will not be hesitate to take it, right? And this MMS, while it is new to Cambodia, it has been used in other countries, and even, in the drugstore in Cambodia, even though you call it a different name, but it is available as well. I mean, so it should not be used as something we use to test the health, right? Because that is one of the rumor that you need to prevent. So the midwife asked women also to keep the dissecant in the bottle and demonstrate how to open the bottle so that, it easy for them to know how to open it, because some of them, they report to us that it is hard to open the bottle. So instructional handout were given to the woman on how to open the MMS bottle, and we have a number of the poster and leaflet to provide, to them on the benefit and importance of the MMS, so that they believe in taking and, keep this MMS during the whole study. So the field staff replaced the exact number of the pill that were lost. I mean, that is the solution as well, as I said. So what are the next steps for this study? I mean, so The plan is that in 2024, we will conduct additional trail of improved practice, what is called a TIP study. And this will include the co-designing ANC counseling material and job aid related to the MMS with health center staff and other stakeholders, including the pregnant woman. And we will conduct the field tests of those material before finalizations of the material to be used. Secondly, we will do the co-design social behavior change message and reminder aid, such as the calendar reminder or the flyer message reminder for the MMS for the pregnant woman for use at home. And then we will also conduct the field test on that message as well before finalizations. And we will also train the health center staff as a pilot on the counseling strategy and appropriate messaging for the MMS during pregnancy, so that the training model, training message and material will be tested and finalized before the rolling out of the MMS to the whole countries. And we plan also to assess how ANC health provider, like the health center staff, counseling affect the MMS adherence among the pregnant women using the TIP study approach. So that is going to be very, very important in 2024. But for the adherence and feasibility study, we will conduct the data analysis to get the finding for the dissemination workshop to be held in February 2024 with the steering committee and with a wider group in March 2024. And that, if the delegate from Lao PRD and the DP from Lao want to join the dissemination workshop in March 2024, you are more than welcome. We also plan to revise our micronutrient guideline in Cambodia and nutrition manual to include MMS, right? Because the current micronutrient guideline and the nutrition manual only contain the message on IFA, so we need to revise that. We will also work with the MOA to proceed the inclusions of the MMS in the essential medicine list. And finally, we will have to develop the comprehensive plan for MMS rollout to replace IFA with MMS for the whole country, right? So with that, once again, thank you very much for the opportunity, and my presentation is ending. Thank you very much, and over back to you, Kelly.
Thank you so much, Kroeun. That was really interesting, and I can see that we in Laos can benefit a lot from your study. I'm sure that there are participants interested to join your dissemination workshops next year as well. And it's good to know that the research is ongoing and that you'll continue to get further feedback from your midwives and non-participating moms as well. So we know to keep paying attention. I would like to give everyone the opportunity now to ask questions. You can put your hand up in Zoom, or you can just come off mute if you would like. And please feel free to ask a question. In Lao is fine. Our interpreter can speak in English, and Kroeun might need to, I think that should work. For our interpreter, please come off mute if that's not correct.
Oh, let me also take this opportunity to introduce you because some of our Cambodian study team also joined this webinar, and they will also be able to answer any questions that I might not be able to answer because they are the one who, directly involved with the study. Thank you.
สบายดี
ซึ่ง
ได้ยินเนาะเจ้าขอบใจหลายสำหรับบทนำเสนอที่ว่าเป็นน่าสนใจหลายสำหรับสปปลาวเฮาเนาะโดยเฉพาะศูนย์โภชนาการข้าพเจ้าซื้อวิรสิทธิ์เนาะจากศูนย์โภชนาการอยากมีคำถามเกี่ยวกับตัวการย้าย IFA เนาะ Acid Folic นะว่าผลการแจกจ่ายอยู่ประเทศกัมพูชามันมี side effect หยังบ่ที่ว่าเวลาเฮาแจกจ่ายไปให้กลุ่มเป้าหมายแล้วก็ในเวลาเขาเจ้ากินเขาเจ้ากินดีอยู่บ่หรือว่าอีหยังต่างๆนั่นเนาะเพราะว่าอยู่ในสปปลาวผ่านมาที่เฮาย้ายมันค่อนข้างอยากมี side effect หน่อยนึงนั่นเนาะเจ้าขอบใจ
So, Kelly, can you help with the translation, please?
For this one, I would ask, maybe we can try to summarize again, to ask again. For next time, please click on the interpretation button and you'll get the English. For this time, maybe we can ask our Dr. Vincent to ask the question one more time. Sorry for that misunderstanding.
Okay, let me see.
His question is about the side effects of IFA that in the Lao context, it was noted that there are reports of side effects. Is that correct? Do you want to add more?
ในภาษาแปลเลยก็ได้ครับยังจืออยู่เนาะ
ทำภาษาลาวลดคือว่านายแปลก็อยู่ในหัน
เพราะว่าจะถามว่าการแจกจ่ายยาทันเล็กขนาดอยู่ประเทศที่กัมพูชาเนี่ยมันมี side effect ตัวใดบ่ที่ว่าเฮาเวลาแจกจ่ายไปกับกลุ่มเป้าหมายเฮานั่นเนาะเพราะว่าผ่านมาเฮามีการแจกจ่ายแล้วมันบางคนที่ว่ากินวิตาเล็กไปมันมี side effect อยู่สปปลาวนั่นเนาะ
Were you able to get that, Kroeun?
Yes, thank you very much. Now I can get to the English channel finally. Yeah, I mean, the side effect, as I said, even from the study group, we found that the women who are in the IFA group complain about the side effect. And there's a different side effect, right, from the IFA, including, it's make them feel not very well after taking the IFA, and they feel vomiting, right, after taking the IFA, and somehow, I mean, I heard that when they also see the color of the stool change, like black or something like that. So that is some of the side effect we found in Cambodia context. So as a result, pregnant women in general, they stop taking IFA because of the side effect.
Does that answer your question? Did you want to ask any follow-up question? Okay, I assume that works then. Thank you very much for that to confirm. I think we have a question from Dr. Somphon of the Lao Tropical Medicine Public Health Institute. I would like to offer Dr. Somphon the floor.
Yeah, thank you. Thank you to give me a chance to join this presentation because of interesting topic and useful topic also. And I heard from you, you will have guideline. It's very useful for we can follow your strategy. My question is, the one is you use the MMS compare with folic acid, but I would like to know like it is for free or not, and then you have plan to measure about follow up the baby after we give MMS in the future or not. If have, it's useful for lesson learned because it is in Laos we quite surface with anemia a lot, and then micronutrient also deficiency. It is very useful to lesson learn from you also. Thank you.
Thank you very much, Doctor. So the MMS supplementations are provided free, for this study. And if it is going to be replaced, the IFA, of course, the MMS will be provided free as well because it will be through the health system, right? The same like IFA. And your question, the second question is really interesting because as I said, many studies already conducted around the world, and we have the 21 randomized controlled trial around the world which indicate the important and benefit of MMS for the mother as well as the baby health. So that study have been conducted many countries in the world, and the result of the study it's already been disseminated throughout the world. And the last micronutrient forum in Netherlands, they discuss a lot about the rolling out of the MMS and replacement of IFA with MMS based on the benefit they found from those 21 randomized controlled trials, which they conducted with over 141,000 pregnant women, right? So interesting, your questions, but the study already been conducted. For Cambodia, we need to discuss with the steering committee if they want to follow up the baby who will deliver after the study, right? To see if the finding will be aligned with the global evidence. Thank you. And the question that you raised about the iron, the IFA, the iron deficiency, it is relevant because if you look at Laos as well as Cambodia context, maybe similar. And we conducted several studies in the past. What we found is that the cause for iron deficiency anemia, is not iron deficiency, which means that the majority of anemia problem is genetic hemoglobin disorder. In Cambodia, the iron deficiency is account only 3% to 7% among the women of reproductive age, although the anemia rate among the women of reproductive age is 54%. So if you provide, iron tablet to those who are not need for the iron, right? Then it might be there's some problem. I'm not sure about the causes of anemia in Laos, but in Cambodia, 60% of those who have anemia are not iron deficiency. you know what I mean. So, you know, and in addition of that, I mean, as I said in early presentations, when you give iron acid folate, you only give pregnant women iron and acid folate. But if you give the MMS, there will be 5 vitamin and mineral, right? Micronutrient supplementation. So that's a big difference. Thank you very much.
Thank you for that. I think that is a very important point for the Lao context. Currently, we don't have a good understanding of what percentage of anemia in Laos is caused by genetics compared to iron deficiency. We only have small studies. Hopefully, soon, we will have a micronutrient survey to help answer this question and also to let us know what other micronutrients are very deficient in our population so we can build the case for MMS if needed. Does anyone else have a question they would like to ask?
So Kelly, I just want to say one thing for this because I think it is important for Lao.
เจ้าขอคำถามอีกวันหนึ่งเนาะเพราะว่าเจ้าได้ยินอยู่ประจำ
ได้ยินอยู่ถ้าแบบนึงให้คนสุดท้ายก่อนแล้วเจ้าก็ค่อยสิให้เจ้าถามเลยซะ
เพราะว่าอย่างอินเทอร์เน็ตข่อยสิบ่ได้ดอกเด้แค่นี้เอ้ยเพราะข่อยกำลังเดินทาง
Oh, okay. Please go ahead to ask your question.
โอเคเพราะว่ายังฮู้ว่าอยู่ประเทศเขาเจ้านี่นะเนาะก่อนสิย้ายทันเล็กนี่เฮามีการเก็บกับข้อมูลด้วยกวดเลือดเขาเจ้ากันบ่เนาะหรือว่ามีการแจกจ่ายไปเลยหรือว่าเฮามีกวดหาพยาธิเป็นทาราซีเมียบ่จังต่างกันบ่เนาะเจ้าได้ยินแจ้งบ่จ๊ะ
Thank you very much for the questions. Actually, you know, the study, for the study participant, we have a number of criteria, right? And the criteria for this and for those who include in the study consider as a healthy pregnant woman, right? We don't include those pregnant women as unhealthy. That's what I would say. And also the pregnant women, those who are participating with other supplementation study are excluded from the this study. For those women actually have the problem with the severe, with the anemic, with you know, anemic would not be included in the study, right? But for the study itself, we do not test or take the blood to see the micronutrient status for the study participant, because this is purely the feasibility and adherence study based on the global evidence. The efficacy study were already conducted in 21 randomized controlled trial around the world. So that is proven, right? Thank you.
Great. Thank you for that. I think that's a very important point and a very good question. Khun, do you want to share what you were saying before? What you wanted to
Yes, so yes, I think, you know, Kelly, you brought important this thing to discuss here. In Cambodia, you know, because the study conducted by Helen, Keller, UNICEF, and MOA in 2025 among women of reproductive age. And in brief, I can say that the study concluded because we have high proportion of women of reproductive age that have the genetic hemoglobin disorder as a cause of anemia. And if Cambodia to provide the blanket supplementation of iron, folic acid to the woman of reproductive age, that is going to benefit only 10% of the woman, right, in the whole country. So this is something maybe for the considerations in Laos. I mean, Kelly said that you are going to conduct the national micronutrient survey, which would provide you the snapshot on the micronutrient status, including, causes for the for the anemia. And if you see, it's highly well of the hemoglobin disorder, then probably you can do the study on the iron supplementation among the women of reproductive age to see, if they respond to the iron supplement,
Thank you. We don't know for sure that we will do a survey soon, but I think there's a lot of interest as we have a lot of questions. For example, these issues that you described so well. Is there any other question? We can take a few more. If not, I would like to ask a question myself. Prior to beginning this study, can you tell us what were the key worries or concerns of your Ministry of Health stakeholders, and how did you address them, and how did they change, or did they change after the survey or during the survey? Can you share a little bit about that?
Yes, of course. So, we initiated the discussion of MMS in 2019. But then, the MOA have several questions. One is the global evidence. Do we have enough global evidence to say, MMS is really superior compared with IFA? And secondly, they also discuss about the cost. If replacing IFA with MMS, is that going to be sustainable? It's going to be cost effective, the same like IFA, or it's going to be more cost? And then the third one, they are concerned about the side effect of the MMS, because learning from the IFA, the side effect, it took the pregnant woman a while until they can be familiar with the supplement. And sometimes that's why, it affects to the recovery. And so we discussed several times from the high level to the lower level of the decision maker. Is not only the Ministry of Health, but other departments as well, and the private sector, the UN, and of course the UN, UNICEF is very supportive for the MMS, and the civil society as well. Some donors as well, very supportive. So that's why we finally conducted what it called the landscape analysis on the MMS in Cambodia in 2020 with the stakeholder. And, we interview, we consult with the high level of the MOH, but also the government decision maker, Ministry of Finance, Ministry of Planning, to ask them. And at the same time, we build the understanding about the global evidence that actually we generate from different levels, and tell them, the benefit of that MMS over the IFA. So slowly, right, they understand. And however, the cost, because, when it comes to the cost, it surely will be a little bit higher than the IFA. However, that is not the replacement, right? the cost is not replacement of the cost, I would say. You just add some additional cost because generally the MOH and the government already procure the IFA and they spend the money for the IFA. So what you need is that to help them to assess how much additional dollar or cost is going to be add to the IFA, right? So we did that exercise, but we need to do more. I mean, in 2024 to really assess the cost. Although, I mean, now it's already the highly well, but also, you know, the lowly well, donor and other in the same page that we will replace it. I mean, even though we don't know yet the full cost, but we assume that it will not be much more in addition to what already been spent for the IFA. And lastly, I would say we did 2 pages of policy brief to actually compile the global evidence and the benefit, as well as telling a little bit about the cost if Cambodia is going to be replaced IFA with the MMS. So that, you know, in brief, to your question. Thank you.
โอ้ยเบิดละอันนั้นตัวเว้าเรื่องอัน
Go home, so I mute microphone นะดู
อันจริงไอ้ดวงนะใช้ไหนจะกินได้อันเวลา
Thank you very much, Kroeun. That's very interesting. I think it's normal for policymakers to be concerned about the cost, but like you said, luckily this is not something new, but a replacement. So maybe that helps. I'm glad to know that you were able to convince them that the side effects were not a concern. And I hope we can also learn from that experience. Okay, I just wanted to give one more chance if there was a question. Otherwise, I think it's a good time for us to wrap up. Does anyone have a last question? Please feel free. It's a good opportunity.
Yes, Kelly.
Hello.
Yes, thank you for your discuss important thing, but I would like to ask one more question about the cost or accessibility they can pay, or the government can cover this something, or you have the survey or data about cost effectiveness for this MMS or folic acid. Yes, thank you.
So we plan to have the MMS supply readiness assessment in 2024, but I can tell you briefly about how to deal with cost. You know, the current humanitarian foundations actually plan to spend $100 billion in the next few years to purchase the MMS supply for the low and middle income countries. In Cambodia, we will support the Ministry of Health to process for the request to the Kirk Humanitarian Foundations to ask for the free donation for the next few years for the rolling out of the MMS supplies in the countries. And we also have initial discussion with Vitamin and Gel for this initiative to support Cambodia. And the same with Laos. If you are interested, I can make the connections for you to contact the you know, people who are really interested to support the MMS initiative. Now in the world, we are 22 countries already engaged with the MMS initiative. And I think by 2030, they estimate that around 90 countries will, introduce MMS and replace IFA with the MMS. And there will be a need of 97 million MMS, 97 million pregnant women in the world will receive MMS by the year 2030. So that is the estimations. So, it's just a matter of time. There will be, every country at some point will consider the replacement, because that is something the WHO already gave a good sign. As I said, the MMS has been already in the essential medicine list of the World Health Organization in 2021, which allowing the country member state to use MMS, right? So that is the thing. So regarding the cost, if you do this and rolling out, I assume that there will be interest from the donor in the few years after your feasibility study, adherence study, to donate MMS to the country. And after that, you can provide, you can pay additional cost, right, to the IFA, which would be not much, I would say, it's not much, but unfortunately at this point I could not, we have the rough figure about additional cost, but I was not in the authority to provide that information. And next year we will do additional MMS supply readiness assessment, in which we can share openly. Thank you very much.
Thank you for that. I think it's very, very helpful for us to know. And it's important to remember that the cost of IFA goes to zero when you introduce MMS, so it's not adding. And I definitely think that we can continue the conversation here in Laos about contacting organizations that might be willing to subsidize MMS or provide it free when the country begins the process. Seems important. I think that's good for us today. I noted we had at one point up to 48 participants, and I'm sure many people will also access this webinar online. Many thanks to all of you who stayed on with us through the hour, and please do not hesitate to be in touch with the project team if you need additional information. The slides are in PDF in the chat box. In case you want to share them with your organization. They will also be linked to the YouTube video and the website for the YouTube link to find our seminars is in the chat box as well. We will have another seminar next month, and it will be in the first week of the month, hopefully on Wednesday, but sometimes we make a change like today to Friday. And we look forward to seeing you all again. Thank you again very much, Kroeun. We appreciate you giving your time to us today, and we look forward to hearing more about your work.
Thank you very much, Kelly and everyone, for the opportunity, as I said. And the presentation is actually updated. So I will send this version to you, Kelly, so that you can share with the audience.
That's perfect. We will send it out to our registered participants and also link it to the YouTube.
So thank you very much. As I said, if the Lao PD or delegate want to organize a group visit to our research study, you can request to the, Ministry of Health, the government, so that, we can also if you can request through us as well, that is no problem. We are happy to help, right, to support. So with that, thank you very much, and we'll be in touch.
Thank you so much. Thank you, everyone. Bye-bye.
Thank you. Bye-bye.
Bye.
ขอบใจหลายๆเด้อแคลรี่
Ciao.
แล้วก็ทุกคนเด้อที่เข้าร่วมมื้อนี้ทั้งอาจารย์